Hello, everyone. Good morning, good afternoon, good evening, and wherever you're joining us for today's webinar on Health for All, Universal Health Coverage through Self-Care. My name is Mfonobong Timothy, and I'm the Practice Development Transformation Project Coordinator here at FIP, and I'll be your facilitator for this webinar. Please in the chat box, let us know your name and where you are joining us for this event. Every year, the 12th of December marks the Universal Health Coverage Day, a day where we raise awareness, celebrate the progress so far, and also urge action to ensure that there is accessible quality healthcare to all populace without financial burden. And at this event today, we'll be exploring this and the role of self-care in universal health coverage. Some housekeeping rules before we progress. This webinar is being recorded and live streamed via our YouTube channel, which means you could always rewatch it after today. And then this recording will also be available on our website, www.events.fip.org. That's our events website. And we implore you to use the Q&A box throughout this event to ask your questions. Please use this box, because if you use the chat box, your questions might be lost in it. So use this box, and during the session, your answers will be provided, or towards the end of the event, these questions will be answered. We also welcome feedbacks for this event and other events here at FIP. Please send your feedback to webinars@fip.org. And we encourage you to be a member of FIP at fip.org/membership_registration to enjoy the benefits of membership. This is just a sneak peek to the lineup of activities we have today and the wonderful speakers that we'll be having during this event. So just sit tight as we go through it. Our objectives for today: by the end of this event, we hope that the attendees would learn the role of self-care in easing the strain on the healthcare system and also advancing health equity. We would also learn the potential of empowering self-care through health literacy, and that way integrating self-care into universal health coverage strategies and enhance health and systemic cost effectiveness. You've learned the role of public-private partnerships in enhancing pharmacists' capacity to provide self-care services and resources to the public. Then we'll also look at the WHO framework and our new FIP Knowledge and Skills Reference Guide to support pharmacists in providing these services. This is our program for today. I'll just give you some seconds to look at it. We're having 3 presentations, and then we'll launch our guide. We'll take some question and answers, and then we'll wrap up. So to give the opening remark and to steer the course for this event, I'll be handing over now to Lazak Sunderland, who is the Vice President at FIP. Over to you, Lazak.
Thank you, Mfonobong. Dear colleagues, dear friends, welcome everyone, and thank you to those joining us live and to those listening in afterwards. I would also like to warmly welcome our speakers today, whom I will shortly introduce. As my colleague mentioned, our webinar today is titled Health for All, Universal Health Coverage Through Self-Care. And my name is Lars-Åke Söderlund, and I'm one of the Vice Presidents of FIP. It is indeed a great honor to be with you all today and having the opportunity to share this very important session. As Mfonobong mentioned, this Thursday is International Universal Health Coverage Day. And universal health coverage is about ensuring that everyone, including those who are most vulnerable, has access to quality health care without financial hardship. And FIP's vision is aligned with this goal. We have long advocated that pharmacists, with their convenience of access, expertise, and expanding range of services, should be recognized as key contributors to achieving universal health coverage. Our work is focused on supporting pharmacists to deliver through the advancement of practice, science, and education. And our actions include providing educational resources to equip colleagues with the skills to offer expanded pharmacy services and sharing knowledge of such services from around the world to encourage others to implement them. And a prime example of this is pharmacy-based vaccination, with 4 new advocacy resources released last week, providing an overview of successful implementation of pharmacy-based vaccination across 7 countries and adding to the existing wide range of other resources in this area. Next slide, please. Self-care refers to any deliberate and voluntary action taken by an individual to maintain and improve their physical, emotional, and mental well-being. It focuses on promoting and maintaining well-being, preventing disease, and coping with illness. The goal of self-care is to help individuals manage stress, reduce the risk of illness, and enhance their overall quality of life. And this is where pharmacists can play an active role. Next slide, please. Next slide, please. As highly accessible, highly skilled, and trusted healthcare professional, pharmacists play a key role in supporting and empowering informed self-care. It is worth noting that the WHO, the World Health Organization, website focusing on self-care uses an image of pharmacy to illustrate the theme. And the video, as you can see to the right, showcases the practical and impact ways some colleagues support their patients in self-care. Next slide, please. FIP has very many resources available on the area of self-care that can be accessed through the library on the FIP website, fip.org, or the dedicated microsite as well. Next slide, please. Now I would like to introduce the first speaker, who will be presenting on engaging healthcare professionals in the promotion of self-care. It is an honor and pleasure to introduce Dr. Manjula Narasimhan, Acting Unit Head, Sexual Health and Wellbeing across the Life course from the World Health Organization. Welcome, Manjula, to give us your presentation.
Thank you. Thank you so much. And thank you to all the organizers for inviting me today. It's a real honor and a pleasure to be here. As was mentioned, my name is Manjula Narasimhan. I'm in the Department of Sexual and Reproductive Health and Research at WHO in Geneva headquarters. And so today I was asked to give just a little bit of an overview of the work we're doing at WHO around self-care and some of the resources that include the role of pharmacists in promoting self-care. And we have acknowledged from the very start of this work at WHO that the importance of engaging healthcare professionals, but in particular pharmacists, and the role of over-the-counter access to medicines, to devices, to diagnostics, to counseling and support that pharmacists play such an important role in. Next slide, please. So this presentation is really just a couple of slides to give a little bit of an overview, and this, I'm talking to the converted here, but really we know that self-care is an essential component of healthcare delivery from a health systems perspective and from a person perspective, and important to communities as well. And in this model, although we acknowledge that we might need specialized care in some instances, we might need interactions with health professionals, and particularly specialized health professionals in some instances, the basis of all action related to healthcare is grounded in self-care. It improves the autonomy, as was already mentioned, And hopefully it can also be done in a way that reduces costs to the end user. Next slide, please. So self-care is really the first line of action for all healthcare. And in our WHO definition, we are looking at both the actions people are taking, such as going to the pharmacy to pick up an over-the-counter product, or doing physical activity, or even brushing teeth. These are all actions that people take and have been taking since the dawn of time. More and more in the public health space, there are biomedical interventions that are being promoted from a health system perspective, covered by various funding mechanisms, and absolutely essential in moving both the self-care agenda and the role of pharmacists forward. And here I just wanted to flag that among the horrors that COVID inflicted upon us all across the planet, the silver lining was that it was a defining moment in the acknowledgement of the role people play in managing their health, and the role that pharmacists play during that time, in addition to before and after, but during that time in supporting the access to essential health services, including, for instance, the contraceptive access, including self-tests, as we know, across the globe. Next slide, please. And so the conceptual framework we have at WHO is really placing the people at the center. And these could be clients of health services or patients, but placing them at the center and moving away from a disease perspective to one that focuses on health and well-being. And we acknowledge that the principles of human rights, of gender equality, a holistic approach to people's health, acknowledging their need across their life course, and the ethical principles in providing care, including to the most underserved and vulnerable communities, is something that's going to be key to making this process essential and sustainable. Because without that, we don't want to add additional burden to end users. We don't want to add, whether that's financial or additional stigma, or making them feel less well served in healthcare. But we acknowledge, and this is important for this conversation, that the places of access of healthcare delivery have dramatically changed in recent years, and pharmacies play such an important role in additional places of access, and caregivers, and care that people can do for themselves in the home. All of these are now acknowledged in the way forward. But in order for healthcare to be delivered in a way that is meaningful, that is sustainable, that enabling environment, that safe, supportive environment is really important. That the appropriate messaging is there, that the education, access to justice if you are facing stigma and discrimination, all of these components are essential. And a trained health workforce, and that is trained to promote and to introduce self-care options, is a critical element of that. And as I mentioned earlier, the accountability of the health sector, the accountability of the private sector, the donors, the government, and the social accountability is as important as the individual's decision-making with relation to their health. Next slide, please. And the guideline from WHO was first published in June 2019, only 5 years ago, and was revised in 2022. It includes a lot of recommendations, but also good practice statements. The examples here are around infectious disease and reproductive health and sexual health, but the guideline covers more than that, includes health promotion, includes NCDs, and many of the existing WHO recommendations. And we are currently exploring the possibility of revising it further for next year to include more recommendations and a broader scope. Next slide, please. And following the publication of the guideline, we published this year the implementation guidance for health systems. And this is particularly relevant for member states and for policy makers, but also for health professionals. And the framework here, I won't go into this in detail for the lack of time, but it's really grounded in the health system building blocks about providing the information, supporting competency-based training for the health workforce, supporting equitable and sustainable service delivery, actions for the leadership and policymakers and governance, looking at what type of new technologies and products, including the role of digital health in supporting self-care actions, and then the financing, which is a critical element of making this work move forward. And so this guidance was published in July of this year and is available online. Next slide, please. So to come to the focus of this webinar around the self-care competency standards for health workers, the WHO developed a few years ago competency framework for UHC, and we have built upon that UHC competency framework to develop self-care competency standards. And here are the three documents, they're interlinked. And the first one is very much around standards of self-care for health workers. And the next two are around the knowledge guide and a curriculum guide for health and care workers to support people's self-care. Next slide, please. So the first competency standards, we have 10 key competencies that are needed for health workers to enable self-care, and they're listed here. And it's really about the clients and the patients being able to access healthcare within health facilities if they need to, but for the healthcare workers, including pharmacists, to be able to promote self-care options, to communicate effectively about this, to show them the range of options that might be available that include to self-care. And this needs to be done in the context of, as we said earlier, ethical considerations and ethical conduct, undertaking reflective learning about self-care, also to avoid burnout of health workers, and then collaborating also with other health and care workers, providing referrals if needed. Next slide, please. The knowledge guide is we're very excited that FIP is going to launch, and I won't go into this in too much detail because you have a wonderful knowledge guide that's going to be shared soon, and we have done ours is a little bit more overarching, and it's for health and care workers, writ more large. But it takes those standards of care that I just talked about in Volume 1 and looking at various domains and how people-centered approach can promote, for instance, self-care. Next slide, please. And the curriculum guide, in which we really hope that for pre-service and in-service training, this can be something that becomes the norm and not an example. And FIP has just been taking leadership in this, and we're looking at steps for adapting existing curriculum and incorporating the standards of the competency standards for self-care, where it is suitable, where it's feasible, where it's affordable and appropriate, and this includes sort of the rational delegation of tasks to end users and patients when appropriate. Next slide, please. Just one example from an intervention that is recommended by WHO. So we have a series of interventions, for instance, around contraceptive access, and there's a specific recommendation on over-the-counter or oral contraceptive pills that should be made available without a prescription. And this includes, for instance, emergency contraception, and each recommendation is grounded in the evidence and the systematic reviews. We've developed a policy brief or a technical brief that can support people to access over-the-counter contraception through pharmacies, and that's just pulling out from all the recommendations. They are specific to this recommendation and the technical briefs that can support the implementation. And also with the WHO Academy, which is a new learning center that will be inaugurated actually next week in Lyon. There are a series of online learning programs for health workers. And for the self-care, we actually started with the online learning tool that for pharmacists and over-the-counter access to pharmacists, so that these are available. These and more tools are available for everyone. Next slide, please. Yes, and so we developed the communication toolkit. Again, this is available, and all of the resources from WHO are included, including the technical briefs, including videos and access to the guidelines and the implementation guidance that I mentioned, and the self-care competency framework. And I think that's it. I think that's that last slide. Yes, and thank you again all very, very much for this opportunity, and I look forward to the launch of your document soon. Thank you.
Thank you so very much, Manjula, for sharing how the World Health Organization looks upon self-care and the crucial role it plays in achieving universal health coverage, and also the essential tools for self-care available via the World Health Organization. Indeed, the healthcare landscape is evolving, and with a growing emphasis on proactive, people-centered approaches that empower individuals to take greater control of their health. I think we can foresee a very exciting future when it comes to self-care, and also the role of pharmacists. I mean, the role of pharmacists, they have a unique and pivotal role in this transformation. Thank you so very much for your presentation. Let's now move on to our next speaker. Our next speaker is Austin L. Osta, Director of Self-Care Academic Research Unit, SCARO, at the Imperial College in London, United Kingdom. Austin L. Osta will actually give us a presentation on self-care is the critical answer to tackling non-communicable diseases, NCDs, and promoting universal health coverage. Welcome, Austin.
Thank you, Lars, and thank you, colleagues, for inviting me to present today. I'm really pleased to be here. So it's great we heard Manjula's talk first, because there's a lot of very useful context that we can work with. I'm going to present for about 12 minutes, and just briefly to describe SCAR, a lot of you would know, but we were established in 2017 as a collaboration between the Self-Care Forum UK and the International Self-Care Foundation as the only university academic unit in the world established to make the absolute case for self-care. So really pleased to be here and to be adding to the academic value of self-care. We started because I think there was wide recognition that lifestyle diseases that a lot of people we know and some of us ourselves are suffering from, whether it's obesity, some types of hypertension, cardiovascular disease, and so on. These are all lifestyle diseases. And actually, if we were to self-care more, we can prevent, delay, or change the trajectory of these lifestyle diseases. So that was the tenet of our genesis, really. And we were also looking at the emergence of the lifestyle medicine movement, which is now established in the UK, in Europe, and in the US. So these are doctors who specialize in lifestyle medicine and prescribe lifestyle over drugs. Because we know from anecdotal evidence, some experiments, that actually you could reverse type 2 onset diabetes or prevent it, and prevent 81% of heart attacks and so on by self-caring more. So the first thing we did is looked at literature, and of course we realized so many excellent definitions of self-care, including the 5 from WHO, and an academic paper in 2011 showed us there are actually more than 140 definitions in the literature, because the term is often used interchangeably. Now, this is important to us, but also important to people when we talk to clients. What do you mean by self-care? It can mean anything, really. So we're very aware of that. And that's why we thought we should really begin to approach self-care as a concept. And we looked at many models, and this is the self-care continuum, which you'd know, showing us the ideal placement of the self-care being here on the left. That should we be on the left, we don't need resources, we could do what we want, we could have the lifestyle we need. But if we do become ill with a limiting condition or break a leg on a skiing trip, we might slide along to the middle, we may need analgesics and then slide back to the left. And there are exclusions, for example, people who are incapacitated, are on the far right of the continuum, and people with long-term conditions are somewhere in the middle. So this is an important perspective that we adopted early on. And also we looked at the mid-level activities that people can do on a daily basis that constitute self-care. And you'll be familiar, of course, with the 7 pillars of self-care framework. And I think most relevant to pharmacists and pharmacy land really is pillar 1 of knowledge and health literacy, as Manjula said. Health literacy is important. Of course, and the rational use of products and services pillar, which includes over-the-counter medicines, technologies, and digital. So the first thing we did was to consolidate these models into the self-care matrix. You would have seen this before, but basically it's a new point of departure for self-care thinking and describes the totality of self-care, from the activities that people do to the behaviors that they need to sustain to the resource utilization context in the context of the wider environment. So this is a helpful framework that we could use as an evaluation framework as well, to evaluate the extent that an intervention is activating pillars and sustaining behaviors and so on. Many enablers of self-care, and of course, pharmacists are included here. And how can we work with all of that to, make people expert self-carers? So what is the role of the pharmacy and the pharmacist generally? Also recognizing that there are many different stages in life and our self-care needs vary. So when we're very young, it's probably hygiene and health literacy and so on. When we are older, going to university or school, financial literacy becomes important, heartbreaks, maybe sexual health even becomes important. And maybe in middle age, where we are, I think it's about managing stress and limiting sort of conditions and really preventing NCDs. And of course, as we age, our needs change. It may be more about psychosocial domain, but certainly our use of pharmaceutical technologies and devices and our need for resources and health and care professionals increases equally. So I can't seem to, yeah, there we go. So there's a bit of a lag, but yeah, so it's great that just to highlight, there's a huge movement, of course, you're part of in the self-care space. We were established in 2017 in the UK. WHO published the first excellent guideline, which changed the game really. An explosion in self-care there's an explosion of self-care activity since. We're all part of a coalition to try to advance a WHO resolution on self-care in the future. And that is very exciting because now I think self-care is being taken seriously. And here we have Manjula and Gonzalo, I think, from FIP is somewhere in the picture. Last year in London, we held the London Self-Care Summit, where we looked at the future and identified the R&D priorities and megatrends for self-care from now to 2030. And as I discussed, there's a big shift now to an emphasis on health literacy, or maybe a rebranding of that into what we're calling self-care literacy, which basically, again, signals a new point of departure when people think about self-care. Manjula described the WHO perspective, which is really important, and that's why there's a movement, because self-care is recognized by the WHO and by governments globally that it is the true enabler of universal health coverage. So in the context of self-care and the recommendations and the guideline, you have self-management, self-testing, self-awareness. These are all things that Pharmacy Land are very well equipped to support in the self-care journey. And of course, these will be enabled by technology, facilities, and caregivers. And the idea is that unless we have people relying more on themselves and trying to self-care where possible, then there simply won't be enough resources to sustain the system. And therefore, universal health coverage, things that some countries or settings may take for granted, may not manifest elsewhere. So it's really important to flatten the curve, so to speak, and invest in self-care to free up more resources to promote universal health coverage. And by the way, so although UHC is very important, some countries like Brazil, I learned recently, are more passionate or concerned with universal health access. But all countries, of course, need to provide the basic minimum, which is the universal health coverage that is really needed. And we're far from actually achieving that globally, which is why this movement is so important. So Manjula, thanks to Manjula and her work and the team at WHO, we've got excellent cadre of publications and frameworks from the WHO that have really, reinvented the narrative around self-care. And now, as you can see, is being taken more seriously. The guideline, which was updated, the competency frameworks, which you would know very well, the classification framework Manjula mentioned, and the implementation guide. And of course, so the role of pharmacy is really important. You would have heard this before, but pharmacies aren't just a place where we go and buy stuff. There are places where we can engage with our personal health well-being journey. We can speak to experts, where we can access digital devices, blood pressure monitors, point of care testing, and in vitro diagnostics. So this is really important, and I think that's one of the big mega trends, of course, that you're sort of leading as a FIP. In the UK, we've got some very good examples of national frameworks and facilities whereby people with a self-limiting condition will be given free access to over-the-counter medicines to help them stay out of primary care. And this applies especially to people who are underserved or who come from a deprived background or haven't got, for example, the financial means to do that. So this is a really exciting initiative that we're evaluating across the UK. So it morphed, it changed, but it's called the Self-Care Advice Scheme in most of London and elsewhere. So health literacy, we have seen, is the key in the ignition of self-care. And there is this idea that we really need to revisit health literacy in a big way, starting from schools, in the workplace. How health literate are we? I mean, one question I ask myself and others, do we actually know our blood type? I certainly don't. I think it's a B, but so, health literacy can mean anything. But what is the basic minimum set of health literacy that we need to know throughout the life course to give us a good chance of being good self-carers? And that's the self-care literacy movement that we're talking about. And we're working as a group to try to develop that and give it some depth that becomes useful to people and places. So digital self-care is a big agenda item, of course. It is now and it's in the future. We've got lots of apps of varying quality and effectiveness, but lots of apps on the market, all consumer-based, of course, at the moment. Symptom checkers are on the rise, lots of wearables and devices, and of course, point of care tests and bigger, clunkier things that don't belong in the home usually, but they're becoming cheaper and more accessible. So this is a huge movement that I think pharmacy has a very important role to play, because this is all personal health record. It's not electronic health record. These aren't data that primary care or hospitals keep. These are data that you may remember or write on paper or lose or maybe have on an app. So there is this opportunity for pharmacy to work more closely with people around their personal health record, and certainly to talk more to primary care. We'll come back to that in a minute. So there are big important trends happening internationally. You've seen the big movement in e-labeling, and of course the scale up and regulation of e-pharmacies, which are important. If we have virtual consultations and online modalities, why not have that in pharmacy and get stuff delivered to you without you having to go wherever possible. So I'm going to quickly now conclude by just giving a big view on, what are our R&D priorities and what are actually globally important that we're working on with partners. So for some time, we've realized there's a really important gap in how do we measure someone's self-care capability. There isn't a perfect way. There are many tools, some direct and some proxy measures. So we've been working for some time now on the Capitan, the self-care capability assessment toolkit that would help us measure someone's self-care capability across several domains, including psychosocial domain, digital literacy, and so on. So although we were focusing on self-care capability, our index, others like the Self-Care Readiness Index by the Global Self-Care Federation looks at self-care in a different way. It considers the role of pharmacy in the country and policymakers and availing over-the-counter medicines to people who need it. So the higher the Self-Care Readiness Index, the more likely the self-care is able to access the OTC and treatment that they want from pharmacy land. Haleon did another angle whereby they actually measured the inclusivity of each country based on 37 indicators. So these are really interesting frameworks and ideas that pharmacy could work with to see, well, what can pharmacies do to promote self-care capability, promote self-care readiness index, for example, through more prescribing and so on, and more inclusivity. So just to conclude, I think just a reminder that I seem to be stuck on a slide. Apologies, I seem to be stuck on the slide. Can somebody move it to the next, please? I can't seem to transition it.
Yeah, sure. Mafon, can you transition, please? Take control of the mic.
I think that was my penultimate slide, but just wanted to say that self-care is celebrated do this every year on International Self-Care Day on 24th of July. And it's great to have these celebration days like today, for example, health coverage. So thank you for inviting me, and I hope this was a helpful round robin, which many of you would have probably seen or heard before, but it's really important to reinforce that narrative and create a vocabulary that is helpful when stakeholders talk about self-care in a way that is inclusive, but also, I mean, one of the things we haven't discussed in detail is, you know, what is and what isn't self-care, you know. So we're drawing an academic boundary around it, thinking that really important self-care practices like yoga and other types of important self-care, we need to revisit these in vitamins, mineral supplements, and sort of herbal traditional medicines. So we may be engaging in that space more in the future. But thank you for hearing me out, and I'm pleased to be here. Thank you.
Thank you so very much, Austin, for giving us an update on how self-care actually do deliver many important benefits for the patient and the healthcare system as well. And of course, by using the pharmacist in self-care, and also the importance of making self-care everyone's business and highlighting the need for both health literacy and self-care literacy, as well as some of a future look of what is expecting, what we can expect, and also how. I agree with you. I think we should have sometimes a more holistic view of the patient, not only focus on symptoms and medicines, entire perspective of the patient. I think that is important. Probably we will come back to that in the future. So now it's time for our third speaker, Dr. Safira Hussaini, Senior Pharmacy Research Manager at Peter MacCallum Cancer Centre in Australia. Welcome, Safira, to give us your presentation on pharmacists at the front line of advancing self-care and universal health coverage.
Thank you so much, Lars, and I'd like to extend my sincere thanks to the entire FIP team, Dahlia, Genuine, Mafon, Albina, Lars, and the other speakers, and also the contributors to the Knowledge and Skills Guide. It's a pleasure to be here, and I'd like to begin with acknowledging country. So I'm speaking from Melbourne, Australia, and I'd like to acknowledge the traditional owners of the land, that is the First Nations people, and where I'm presenting from is the Bunwurrung land. So next slide, please. So much of my presentation contains content that has been aptly covered by Manjula and Austin, and I think this is just a nice way to recap and refresh what we've already seen. But I will be skipping over some parts just because they have already been covered. So in terms of why self-care is important, both the speakers have already covered that, but I'd like to just emphasize that around 400 million people worldwide lack access to essential healthcare services, and around 100 million people are plunged into poverty because they have to pay for healthcare out of pocket. So, and at the same time, with all these new diagnostics and devices and drugs, and like Austin showed us, e-pharmacies and platforms coming out, it's transforming how people are interacting with the healthcare sector. So what's required is a way to go beyond that conventional health sector response, and self-care is one of those solutions. And I wouldn't say it's exactly a new approach, but it's a transformational approach, like Lars has mentioned, where it can help towards achieving universal health coverage and ensuring nobody's left behind. So the definition of self-care is already there, and you've seen this before, and it really relies on providing appropriate support from different healthcare providers to carers and to people, and then that's promoted and supported by community health workers as well. The scope of self-care can include things such as health promotion, disease prevention, all the way through to seeking specialist care and rehabilitation, and it is a life course approach. Next slide, thank you. Austin showed us this figure already. So self-care involves self-awareness, self-testing, and self-management. And some of these things people have been doing for a while now, and some are a bit more newer. So things like self-injection or self-examination are kind of coming into the forefront of what's being promoted more recently, compared to self-medication or self-monitoring. And this is embedded into accessing healthcare systems and, of course, living everyday life and carrying out activities of daily living. Next slide, thank you. Manjula showed us this diagram where we have self-care at the centre, which is critical for health and well-being, and surrounding it we have key principles. And I'd like to just draw your attention again to the places of access. So pharmacies are mentioned there, along with health services, a community, home, and then the enabling environment is critical here. And many of the things or the components in the enabling environment can be activated through pharmacies. So education and information are the obvious ones, regulated quality products and interventions as well, and then a trained healthcare workforce, of course, but also things like psychosocial support, commodity security, supportive laws and policies. And I'll show you some examples a little bit later on and how those can be activated. And I think we have another image as well on this slide that can be shown. So in terms of what sort of outcomes self-care can lead to, of course, it can improve a person's autonomy, but it can also reduce disparities in care. It can improve equity in care. It can also improve health and social outcomes as well, and reduce costs and enable more efficient use of health resources. And family, friends and communities and digital platforms and mobile technologies are two of the biggest influences in people's lives in terms of promoting and accessing self-care, but all the other people and enablers, excuse me, shown there in that diagram are also important. Next slide, thank you. So in terms of the role of pharmacists in self-care, we've already heard quite a bit. And I just want to go through this enabling environment diagram a little bit more and show you those examples I mentioned. So if we can bring up the examples, please, Mafon. So for example, Boots Pharmacies in the UK, around 2 years ago, they introduced safe spaces where you have a pharmacist who's trained in providing support and triage to person who's experiencing domestic violence, and they have a safe space set up in the pharmacy where a person can come in and it's a discrete point of access, and they can make a phone call or they can access information and seek that specialized support. So that's actually enabling protection from violence, coercion and discrimination, as well as education and psychological support and commodity security. We saw in the pandemic worldwide that pharmacist roles in terms of administering vaccination were activated and enabled, and this workforce activation increased the percentage of the population that were vaccinated. And so, for example, in the US, you had the vaccination certification program introduced in 1996, but it was only really in the pandemic that this grew enormously, and it led to increased number of vaccinations being administered through pharmacies, and the public health role of the pharmacist becoming more prominent in this space. In Australia, you have bowel cancer screening test kits available, and the Rotary program partnered with community pharmacies to provide these kits at a reduced cost. And also at the moment, there's activism going on to reduce the age at which screening can occur from around 44 to 30, given that bowel cancer is a major cause of cancer in Australia. And then finally, there should be another image under that one, which is electronic self-care cards, which are very straightforward, simple intervention. They used to be previously provided in hard copy, and they are usually cover a number of minor ailments and strategies, self-care strategies, and over-the-counter medications that people can use to treat simple ailments. Next slide, thank you. This recent paper published in Exploratory Research in Clinical and Social Pharmacy nicely synthesizes all the different services available and related to self-care and provided through community pharmacies across the world. And you can see from the suite of services that they go all the way through from allergy checks to medication adherence through to triage services and weight management. The key point here that the authors noted was that a lot of the services are really focused around medication ailment and OTC counselling and product information, and that's the scope of the current services provided. Next slide. So what are some of the necessary skills for advancing self-care and universal health coverage? It's not rocket science, they're not high level, but they are very important. And it's simple things like acknowledging people as active partners in decision-making, and that's where shared decision-making comes into play, and respecting human rights, like Manjula mentioned, and taking those ethical considerations into your practice, and making sure that the care you're providing is inclusive and promotes gender equality. Of course, we're taught and trained as pharmacists to provide and promote quality evidence-based products and interventions, but also recognizing at the same time that outside and of those, there are a suite of products and services that people might wish to and consider accessing that may not have the evidence base behind them, but that we certainly shouldn't be dismissing people accessing them. And if they want to give them a go, then we should be supporting that if we can, taking that holistic lens to health. Next image, please. So examples of sexual reproductive health self-care interventions in pharmacy practice. Some of these have already been mentioned. So shared decision-making tools such as digital aids to help people make decisions around what sort of contraceptive would be suitable for their lifestyle and according to their preferences. Pharmacists being trained in providing equitable, diverse and inclusive care such as gender affirming care, and that this care is signposted in the pharmacy so people know that they're welcomed and that they will be treated with respect. Expanding the pharmacist scope of practice to supply the oral contraceptive pill or other contraceptives and educate the public on how to use these. And then, for example, referring on to other healthcare professionals, including allied health and specialists. Next slide, thank you. So the BMJ and the BMJ Global Health have a nice series on self-care interventions for sexual and reproductive health and rights and the feasibility of these. And two of these are shown in the diagrams there. HPV self-sampling, which improves screening for cervical cancer, and one of the pharmacy chains here in Australia is going to be launching this program, so people can come and do this sampling in a private and confidential environment, and it's quick, easy, and also self-administration of depot hydroxyprogesterone acetate injection. And we know that DPMA is a highly efficacious and reliable form of contraception compared to taking the oral contraceptive pill every day, which relies on memory. So these are the sort of interventions that are being promoted, and the ones that already exist include, for example, PrEP distribution in community pharmacies and emergency contraceptive pill provision as well, and with a recent push in the UK for having those available for free through community pharmacies. Next slide, thank you. So in terms of how self-care is recognised in health policies and whether the pharmacist role is also recognised in these type of policies, unfortunately, it's not the case. It is poorly recognised in government policies, and it's not codified appropriately. And also terms such as disease prevention, excuse me, are instead used instead of self-care, and community pharmacy is not generally included in any such policies. So along with that, the pharmacy profession also is a little bit unclear on the concept of self-care in its very broad sense, and it's quite limited to minor ailment services and the provision of over-the-counter medications. However, we've seen that the scope is much broader than that. And the authors in this paper instead they had this diagram where health literacy was sitting at the core of the different activities that pharmacists could engage in to support self-care. Next slide, thank you. And in terms of some of the solutions that could be implemented, as we've seen, Manjula has shown us the WHO learning platform that will be launched, which is very exciting, and having other sort of specific training in self-care that extends beyond non-prescription medications would be ideal. Clarifying pharmacist versus GP roles and competencies as well, where you could have a competency framework, for example, to be better integrated into primary care. And then being clever about how we design pharmacist role around this, using implementation science methods to generate the evidence, but also being cognizant of pharmacists' workflow and making sure that whatever we create can fit into their workflow and is efficient as well. And along with that, the language that we use in policy documents and making sure that it's homogenized and that everything that fits under the umbrella of self-care is codified and flagged that way. Next slide, thank you. Yeah, this is my last slide, which is the key takeaways. So self-care, as we know, is a people-centered approach to achieving universal healthcare. The scope of it incorporates self-awareness, self-testing, self-management in everyday life. And there are several positive outcomes on individuals, health services, and health systems and resource use. And globally, pharmacist roles they are expanding, but at the moment they are limited to minor ailments management and non-prescription medication counselling. And some of the solutions to harness pharmacist potential could include role clarification, training, designing interventions using implementation science methods, and policy reform. Thank you so much.
Thank you so very much, Safia, for showcasing how pharmacists are at the front line and can be even more at the front line of advancing self-care and universal health coverage. I agree, the concept of self-care appears to be poorly recognized by governments. So this year's Universal Health Coverage Day slogan is very timely. Health, it's on the government. So it is very, very, I mean, like the hand in the glove, so it fits very well. And it's also interesting that self-care is really not a new concept, but it doesn't seem to align well with the biomedical approach to medicine. I mean, the holistic approach that underpins it is recognized by all healthcare and support professionals. And it's also a bridge between people and professionals, as also evidenced by all of you speakers today, the explosion of interest in self-care across all media. And despite this, the topic of self-care is rarely taught in professional curricula. It occupies a position where it's everyone's job, but nobody's responsibility, leaving it to the enthusiasts to advocate for it. And that is no longer sustainable. So that is also closely linked to the next speakers. It is now time to present some exciting news for pharmacists worldwide. It's an honor to welcome FIP's Senior Program Lead, Dr. Dalia Bayes, and Genuine Desiri, FIP Educational Partnerships and Project Manager, to present on FIP Knowledge and Skills Reference Guide for Pharmacists Supporting Self-Care. Welcome, both of you.
Thank you so much, Lars, and welcome colleagues on the call and all of the attendees that are watching us and participating with us live. I really must acknowledge the previous esteemed speakers who have provided an excellent overview on self-care, but also on the role of the pharmacist in this very important area that is heavily embedded and vital to achieving universal health coverage. My name is Dalia, as Lars introduced, and I am delighted to accompany my colleague Genuine to launch this exciting and new publication from FIP that has been developed in collaboration, or I must say by guidance, driven by guidance from the World Health Organization, based on the competency framework that our dear colleague Manjula described right at the beginning of this session. So I'm delighted to initiate this, Lars. If I can get this next slide, please. I think I can move my slide, maybe. Yeah, perfect. Thank you. So I won't delve too much into the background because my colleagues have done a stellar job doing that. But the FIP knowledge and skills reference guides are actually a collectible, if you like, or we have a collection of knowledge and skills reference guides at FIP. And I might ask my colleagues to add a link in the chat box to refer all of our attendees to that library. And it spans across different areas of practice, but we are particularly excited about launching this knowledge and skill reference guide in the area of self-care. This tool was developed by adapting the WHO self-care competency framework, particularly the knowledge guide for health and care workers to support people's self-care. The process, which I'll describe in just a moment, involved consulting with an esteemed set of colleagues from around the world by an iterative process. And the reason or the purpose for doing this is we wanted to provide our colleagues around the world, our educators, CPD providers, and even individual pharmacists, practitioners, students, scientists, a tool by which they are able to either self-assess their knowledge in the area of self-care or to support them in actually developing, curating professional development, training modules, courses, programs to support the professional development of pharmacists in the area of self-care. So the KNS reference guide for pharmacists supporting self-care details a set of knowledge, skills, and attitudes that underpin the essential behaviors for promoting self-care. And this really is the crux of the competency framework that was provided by WHO. And we believe that the resource will be a valuable tool to also enhance pharmacists' capabilities in supporting self-care and providing first-class service in this area, supporting the public and members of the public with self-care interventions and self-care initiatives. It's an excellent resource, as I said, for educators, but also for providers of CPD programs in this field. Let's get the next slide, please. Thanks, Emilian. As I mentioned, the development of the KNS was done by an adaptation iterative process, whereby we literally picked up the guidance from WHO with permission to adapt it to the pharmacist role. As Manjula earlier mentioned, those competency standards, the associated knowledge and skills and behaviors are overarching. And WHO has provided us with an excellent starting point, starting with a global reference that we can adapt to what we know about pharmacist roles and the way that the pharmacists support the public with self-care. And so that's where we started. We picked up those behavioral statements, and with the support of an expert advisory group, which actually Safira, Lars, Austin, and Manjula, contributed to as well. So we're very thankful to them, plus other colleagues, which we will acknowledge in just a moment. With the consultation of this expert advisory group, we were able to add, slightly amend, reword, rephrase, incorporate, integrate other areas or knowledge and skills that have been identified in the literature, plus our big library on self-care from FIP, which again, my colleagues can support you with also learning more about those. But in addition to those overarching competencies and associated behavioral statements from WHO, the FIP KNS adapted KNS guide also now has additional competencies and behavioral statements related to advocacy, preventative care, supply chain management, the importance of interprofessional collaboration, and touching on remuneration models, which really are unique to the pharmacist or the pharmacy profession, particularly in patient-facing roles. And so these additional competencies are well aligned with the distinctive roles that my colleagues have described earlier, about the pharmacists playing an integral part in supporting self-care interventions for all individuals and all communities. Okay, lovely. When you visit, when you're able to explore the competency framework from WHO and our FIP KNS guide, you will see that the 6 domains remain as designated by WHO, and they are what you see on the screen: decision-making, collaboration, personal conduct, evidence-based practice, communication, and people-centeredness. So these are the 6 main categories, if you like, main domains, under which we have the various competencies as well as behavioral statements with associated knowledge and skills statements associated with them. And I believe that on my next slide, I also remind everybody how to use the reference guide. As I mentioned, it is a supportive tool for pharmacists to refresh or to develop their skills to supporting their patients and consumers in self-care. It's also to support pharmacists apply these competencies into their practice by upskilling and also enhancing their knowledge in particular areas. And it's also a tool that can assist pharmacists with an interest in supporting self-care in our communities as well. You don't have to be a specialist to do that. I think that we do this in any patient-facing role. And finally, it should support really and inform the design and the delivery of education and training curriculum, courses and programs. And I must say that we must acknowledge that with education and training in the area of self-care, as with other areas in pharmacy education, it really should start at undergraduate level, and for it to underpin the continuum of our professional development and lifelong learning. So it also encourage our educators on the line that are involved in educating pharmacy students at undergraduate level to really have a look at this guide, as it would be a fabulous resource, I'm sure, in your teaching endeavors. And I think, Jenny, when you have slide control next, and I believe that this is the end of my particular segment, but I want to hand over to my colleague Genuine, who is just going to describe how the reference guide is laid out in the document, and you'll be able to see it for yourself once you click on the link soon, or the QR code as we provide it. Thank you so much, colleagues, and thanks a million, Genuine. It's over to you.
Thanks, Dalia, for that excellent background on this excellent publication. And I think you've already mentioned most of what partakes the use of this reference guide. And as you can see on your screens, that we still maintain the 10 competency standards that that we've adopted from the WHO guide. However, you also note that under each behavior, there are additional knowledge, skill, and attitude statements that are supposed to be ideal for pharmacy practice and in whatever context you practice in. So please feel free to dive deep into this tables once you get access to the publication. And with that, I think it's my pleasure to mention or to announce that this publication is now available. It's officially launched on the FIP library, and you can access it by scanning the QR code that you see on your screen right now, or click on the please feel free to share the publication with your colleagues, with your within your networks, and please share any feedback you may have on how we can make it even better, and how as well you're using it in your practice. Last but not least, I'd just like to take a brief moment to acknowledge and express our deepest gratitude to the expert advisory group that worked with us on this publication for their invaluable contributions. I think this work stands as a testament to their dedication, their deep expertise, and their collaborative spirit. Their insights have been instrumental in shaping this publication into a resource that will not only inform pharmacy practice in the area of self-care, but also inspire pharmacies to do more in self-care. Thank you to all the expert advisory members that are shown on the screen for your commitment, your rigor, and for generously sharing your time and knowledge with us. We could not have been able to achieve this without you, and we're truly fortunate to have your guidance every step of the way. Thank you. With that, I will stop here and hand it over back to Lars. Lars, over to you.
Thank you, Dahlia and Genuine, for sharing and presenting this new and very important guide for pharmacists. And I think, as Dahlia mentioned, the guide has been adapted specifically to pharmacy practice from the World Health Organization's competency standards for health and care workers to support people's self-care. And as we mentioned earlier, the healthcare landscape is evolving with a growing emphasis on proactive people-centered approaches that empower individuals to take greater control of their health. And in this perspective, pharmacists have a unique and pivotal role in this transformation. So we will now move on to our panel discussion. So dear panelists and speakers, please open your cameras. I would like to encourage all our attendees to post your questions in the Q&A box. I already have some questions for the panelists, so I will actually start with Manjula. Does the integration of self-care into universal health coverage have any metrics or indicators that can be used to measure its success?
Thank you so much for that question. Austin, in his lovely presentation, he had mentioned some of the challenges that we're having about measuring the monitoring and evaluating self-care outside of sort of a public health space, because the whole point of having self-care is having that confidential, being in the safety of the home and all of that. And I think he shared some of the metrics and the frameworks that are relevant here. And I think there's a real conversation to be had to develop that further. And maybe Austin can speak to the Capitan document that was published. I wanted to, in response to this from WHO, what we're trying to look at is the kind of indicators that countries are reporting on. And these are indicators that already exist, because I know people don't really want any new indicators. These are indicators that exist from a health system perspective. And we started looking at the sexual and reproductive health and HIV indicators. And we've developed a dashboard that includes over 150 of these indicators spread across a range of issues related to self-care. So, and the reasoning behind that was to see, well, if we're going to implement any of our resources, whether it's the knowledge guide or the recommendations from the guideline, what is the what is the situation at a country level that might be an opportunity or that might be a challenge? So, for instance, if there is access to over-the-counter contraception, and Safira mentioned this as well in the role of pharmacists in providing counseling and support to over-the-counter contraception. But in that same country, if there is a policy that limits contraception for adolescents who are out of school or for certain members of the population, then we're going to be found with a situation where we're not going to be able to monitor the progress and the success in a way that we would like. And so the dashboard that we've developed has information for all 194 member states of WHO. So it includes high-income countries, low-income countries, and publicly available data around some of these issues. And hopefully we'll be able to perhaps compare regions, compare countries, and look in more detail at some of the challenges that we might need to overcome collectively in making self-care options available through pharmacies. If I can share the screen, I will. Otherwise, I'll share the link online. But let me see. Can you see my screen? I don't know if you...
Yes, we can.
Yeah, okay. So this is just it's still going through final sort of tweaks. Or some of the maps aren't working, but if you see here, you can click on specific country profiles. If there's Afghanistan, and it gives you demographic data. It gives you some of the, and it's color coded in terms of what has been achieved, what challenges there might be at country level, where there isn't any data. And it looks at, for instance, the enabling environment, taking a little bit of time for it to download, but it looks like at data on enabling environment, on health systems, and other specific areas, so that it's a tool to help monitor some of the progress. Maybe I'll stop there. It's being a bit slow, so I'll just stop sharing.
So that tool is already up and running?
It's being tested right now,
Yeah.
but it is where it's going to be very close to being launched. I was hoping this week, but possibly next week, very soon.
Looks super interesting.
It's already set up. Yeah.
Yes, very interesting. And also, I mean, with regard to the research that Safira did present, we actually found that in many high-income countries, there is not actually a self-care strategy from the health authorities or the government. So this is valid for every country.
Absolutely.
Yeah.
Absolutely. And WHO's Director General, Dr. Tedros, has emphasized that self-care is important for all economic settings and for everyone. So we are really, we want to make sure that people everywhere have access to these strategies, and that we don't have minority groups or more underserved populations, even in high-income settings, that are falling through the cracks.
Yes. Thank you so very much. Austin, as trusted frontline professionals, in what ways can the self-care initiatives pharmacists provide contribute to improving health and reducing healthcare costs without compromising the quality of healthcare as a whole?
They're a really good question. And I think that's a really important one that I think we have to answer in a different way as decades change. So pharmacists for a long time, I think, are recognized as the gatekeepers of accurate health information. I think it's great that we get people to engage with pharmacists to learn more about the self-care options. They could be lifestyle, but more traditionally, they're going to be over the counter and so on, which are really important technology. So I think maybe interactions that could help a patient understand the difference, a very straightforward difference between anti-inflammatory analgesics like ibuprofen and paracetamol could help the patient, for example, understand that if they have these at home, they may be a better judge of when to take the ibuprofen, for example. Now, this is advanced and important self-care that some of us may know. So really, it's an art to try to make sure that the people you're engaging with are as self-care ready as possible. So, I sort of veered off course here. If you wouldn't mind repeating the question, Lars, I think I distracted myself.
Okay.
What was that? That happens all the time.
Yeah. Thank you so very much. Safira, what barriers do you think actually have an impact on pharmacists? And would you say that are there any strategies that pharmacists can use to ensure that patients can assess self-care on their own?
Okay, thanks, Lars. So that's a two-part question. Number one was the barriers, and the other one was strategies, correct?
Yeah.
Yeah. Okay. So I think one of the top barriers that pharmacists experience, and I'm sure anyone who's working in community pharmacy who's online now would really appreciate this, is cost. Cost of living in the pandemic has risen worldwide, and the cost of medications and other health services has increased exponentially as well. And to convince a patient to pay out of pocket for a particular over-the-counter medication, or to access a service where there's no government subsidy, there's no private insurance coverage, means that accessing that form of self-care is either rejected, impossible, or considered momentarily and then dismissed. But when that form of self-care is evidence-based and could benefit the person immensely. So I think pharmacists encounter that sort of barrier, the cost barrier, and in convincing patients of the value of what they're proposing. So it's a value proposition. The other one would be around health literacy. And we know that self-care is influenced by self-efficacy, and that in turn is influenced by health literacy. And health literacy can fluctuate on a daily basis. Doesn't mean that if your health literacy is good one day, that it's going to be the same the next day. There's many influencing factors. So, relaying your message and counseling around self-care, and whether it's an over-the-counter medication or on a minor ailment. You might experience language barriers where you could access an interpreter, for example, if there is a translating and interpreter service available. You could involve a family member, even though I noted that the definition of self-care does really rely on the person themselves. It's a solo sort of form of care, but then you've got community and carers helping. So family members or friends might have to step in to help access that form of self-care, and also connecting with those other places of access. So I think pharmacists have a role there to enable that. For example, a lot of people seek information around health through Facebook. I'm part of even a Facebook group for a health condition, and I get a lot of valuable information through there that I couldn't access from my GP or specialist, for example. So people like me, and then things that you may not think of, like community leaders, places of worship, where they have a really important role in, or influential role in, educating people and hold spaces for people. So there's some of the ideas, along with some of the other, fairly straightforward things like asking open-ended questions to people, providing web pages or web links or fact sheets. But also key for me, I found in my own, experience of accessing self-care, for the healthcare professional not to have a dismissing attitude, to have an open attitude, and to take that real holistic approach. I mentioned it in my presentation because somebody won't access or consider accessing self-care beyond just using medication, prescription or non-prescription, if they're not encouraged to explore other avenues.
Thank you, Safira. We have a question for Manjula. What initiatives has been proven successful in increasing vaccination rates through pharmacy-based initiatives, particularly in underserved or vaccine-hesitant communities? Do you have an answer to that?
So just to say, I think it depends also on the type of vaccination, but certainly if we look at, for example, the Reaching Zero targets, it's a report that UNICEF and WHO co-produce every year. If you look at that latest report, it shows that vaccinations in sub-Saharan Africa, for instance, including for HPV, for cervical cancer, has been doing really well. There's some really good success stories across many areas for HPV vaccination. However, it is true that in North America, there seems to be a reduction in there's a vaccine hesitancy. So it's interesting because it's often in some high-income settings that there sometimes is some challenges, but there are many examples of how, depending on the issue at hand, that the vaccine movement is still going strong and needs to be emphasized in areas where there is hesitancy or there is misinformation and targeted misinformation that we need to overcome.
Thank you. Yes, pharmacists do also have a very,
Absolutely,
I would say, responsible role in discussing vaccine hesitancy and show the benefits for the patients when it comes to vaccination, because also the WHO says that after clean water, vaccines are the most efficient remedy for healthcare.
Yeah,
Austin, could future research lead to a better understanding of self-care's benefits and limitations, and to what extent would that be?
Thank you. I focused really hard on the question now to make sure I answered the right question in the right way. But quite right, research is always important. I think ultimately we're working with competencies, and pharmacists are competent. So to support pharmacies in accessing reliable information, like the dashboards you have discussed, people, great stuff to be able to pick up the knowledge and so on. But also we're dealing with people, and people different backgrounds, different motivations, different phases of life, and mental health sort of states. So it's really important to work with the capability, opportunity, and motivation, and try to get them to become better self-care through behavior change. So a lot of research can happen in that space. I mean, you can talk about how pharmacists interact, in a way that's inclusive and aware of the whole person per person approach. What technology the pharmacists you could use, for example, decision support tools, point of care tests, IVD, to convince or show the patient or the self-care that they don't need an antibiotic. It looks like a viral infection. Or online symptom checkers. So leveraging technology is going to be really helpful. Certainly, I think a huge R&D opportunity is what data the pharmacy holds. We know what data they hold, but oftentimes it's a silo of data, for supply chain, for example, and other reasons, but rarely to talk to primary care. There's rarely this sort of bidirectional flow of data. So I think that's an untapped opportunity. The personal health record of the individual, people more often coming to get help with the NHS app, or how can I connect my Apple Watch, or what does blood pressure really mean? So a lot of research in that space, infinite amount of research, in fact. It's how we use the language and how we collaborate together to have a rising awareness that self-care is research and interest internationally. There are entities and organizations and stakeholders that are committed to championing this movement, and everybody's on the same boat, so to speak. So we're hoping more universities will do research, more collaborations between our stakeholder institutions, and more awareness about the whole self-care movement generally, led, of course, by the pharmacists, who are the coalface of dealing with people who need self-care products the most.
Thank you. I have also listened to you talking about self-driven healthcare and the role of the patient, consumer, and technology towards 2030. It's closely linked to what you just mentioned. Can you explore a little bit about that?
Sure. So there are exclusions in society, people who haven't got access to digital, or who have digital but haven't got internet, for example, because of many reasons, whether displaced or because they can't afford it. But for those who have technology, wearables or otherwise, we're dealing with a situation where there are many silos of data. And one thing we're talking about as a collective is the future is going to be very interconnected. We're going to somehow be able to leverage all these data that we collect for ourselves and use it in a new way. So the self-driven healthcare approach is just to signal a new point of departure, self-care with technology. It talks about the digital self-care agenda. And with the development of smart cities like Neom in Saudi Arabia and other cities around the world, there's sort of experiments at the moment whereby you build a huge sort of cluster of buildings that are very packed. Sounds a bit dystopian as well. And people live there, they don't own anything, but everything's recorded. The ambient temperatures are sort of measured, that their transactions are all there. So, the AI would know you more than you would know yourself. So to be able to somehow use technology and AI and machine learning and assisted coaching and virtual avatars, to give you right in time, personalized support and self-care advice is really helpful. But of course, it has to be done in a way that protects confidentiality, as others have said, that makes sense to the self-care. And the self-driven healthcare movement, therefore, is an idea that this is where the future is going. What we're doing is trying to find ways that it's economically solvent and sustainable, but without this data having the potential to be abused by anyone, or Google or the NHS or government. So we're trying to create a system whereby the architecture, the plumbing, the standards, are such that we can actually trust this technology and begin to put all of our data in one place in the hope that it would work for us. But that's the idea of SDH, is self-care with technology, and I think we're all part of that movement, which is really exciting.
Yeah, it is indeed very exciting, and it will also change our roles as healthcare professionals, and it requires also education and skills to provide the value to patients in 2030, for example. I would raise this question now to Safira and Genuine. Do you think that trained pharmacy technicians could provide many of the necessary functions related to self-medications? If so, can you share some details about this or your thoughts?
Genuine, would you like to tackle that first?
Yeah, I think thanks for that question. I think the simple answer to it is yes. And of course, it has to be confined to the scope and area of practice. And there are cases and situations even around the world where pharmaceutical technologists are offering self-care services competently and within the scope of practice that they're working in. And so I probably have to look again in the FIP library if there are any resources on that. But I do strongly believe that yes, pharmaceutical technologies can support clients in self-care.
Thank you, Safira.
Yeah, I would agree with Genuine's sentiments there that trained pharmacy technicians can provide many of the necessary functions related to self-medications. They already do anyhow. They're usually the first point of contact when a person enters a community pharmacy. They're the first person that the person speaks with, they're greeted by, and they know the ebb and flow of the pharmacy, and this is something that is within their scope. And this would then, free up the community pharmacists to take on those other roles that are within the scope of self-care, such as encouraging people to do self-sampling, self-testing, self-management, using digital healthcare, etc.
Thank you so very much. We are almost at the end of our event, so now I would like to ask each of our panelists to provide a practical take-home message for pharmacists listening. I will start with you, Manjula.
Gosh, I think that the role of pharmacists for to self-care for themselves, to avoid burnout, and to provide the kind of care, support, and counseling that communities and individuals need is so essential. And I hope that community level pharmacists to all other types of pharmacists and that they know that their role is valued and respected in healthcare delivery.
Thank you. Austin, over to you.
I will echo what Manjula has said. Pharmacists are the go-to person, the people, the gatekeepers, I think, and they have they're already very well placed to be leading the self-care movement in the community. It's about raising awareness about the pillars and the frameworks, and self-care is a topic of interest. So, and it's great to see that resources being published today, and also perfectly timed with UHC. Thank you.
Thank you, Austin. Over to you, Safira.
Yes, thank you, Lars. I'd like to say or encourage everyone online and who's working in pharmacy that you should try and provide the self-care that you would like to receive as a patient. So if you were to put yourself in their shoes and think about how it feels when you undergo a health condition, whether it's acute or chronic, what would you like to experience from the healthcare system and from the healthcare professionals that you engage with? And then as a pharmacist, if you're thinking of engaging in this space, you don't have to try and do everything. Try and pick an area that you're passionate about, that could be niche, that could be interesting to you, and give that a go first rather than trying to do everything.
Excellent, thank you. Genuine, would you like to give us a comment as well?
Mine is to just ask that all the pharmacists remain committed to this initiative of self-care, and where possible, make sure you download the publication that we just launched today and share with us any feedback you have on its use in practice. Thank you.
Thank you. Can we then show the slide screen again? As pharmacists and healthcare professionals, we will continue to advocate, of course, for our profession and the value we provide to primary healthcare It is a vital component to achieve universal health coverage. And we know, for example, that the health workforce issues will be a particular area of focus at the next World Health Organization Executive Board meeting in February 2025. And today, as the WHO member states prepare for the Executive Board meeting agenda items on health workforce, the World Health Professions Alliance, of which FIP is a founding member, will be releasing a statement urging these member states to invest in creating a primary healthcare enabled workforce. And linked to what all of you mentioned regarding the future of universal health coverage, I think that we can see that the role of the pharmacist will expand significantly towards 2030 and integrating them more deeply into healthcare teams. And pharmacists will play a key role in personalized medicine, medication therapy management, and the prevention and management of chronic diseases. And with the rise of digital health technologies, we will increasingly engage in telepharmacy, data-driven decision-making, and remote patient monitoring, ensuring a broader access to quality care, especially in underserved areas. And for patients, this means improved medication adherence, fewer adverse drug reactions, and better health outcomes. And for the health systems, the health system will benefit from reduced healthcare costs, more efficient use of resources, and enhanced patient satisfaction, and contributing to a stronger, more sustainable universal health coverage framework globally. Next slide, please. You can, of course, listen to this event once again at events.fip.org, and also stay tuned to see upcoming events in this area and other areas of interest for pharmacy and healthcare worldwide. Next slide, please. I also encourage you all to attend the World Congress of Pharmacy and Pharmaceutical Sciences next year in Copenhagen. The World Congress of Pharmacy in Copenhagen gathers global pharmacy professionals to discuss innovation, education, research, and practice advancements. It features cutting-edge research, networking opportunities, and workshops on improving patient care and health systems. And pharmacists should stay informed on these emerging trends and enhance their skills and collaborate with experts to shape the future of pharmacy. And this is a golden opportunity for you all to be part of this fantastic event. Next slide, please. And as such, we have 3 sub-themes: making it sustainable, making the health system sustainable, making the system work, and making it personal for the patient. So I think this will be a very exciting event where we also will highlight the use of technology and artificial intelligence, etc. So by that, I would like to thank you all for attending today. I would like to thank specifically our fantastic speakers and panelists for sharing your experience, your wisdom, and of course, FIP for presenting the new knowledge and skills guide. That will help us a lot as pharmacists working with self-care. Thank you, all of you, for your fantastic contributions, and I wish all of you, including our attendees worldwide, a nice day. Thank you so very much, and goodbye.